Hi. One of the most common questions that a new parent faces is about the feed frequency and the feed pattern, how much to feed the baby. So we have two groups of babies. A majority of the babies hopefully are going to be exclusively on breastfeeds. I'll discuss this group first. And there is a small group who have mixed feeding or sometimes exclusive formula feeding, which we hope is a very small minority. Exclusive breastfeeding has huge advantages, and you can refer my videos, the playlist on breastfeeding, to understand more about it. And breastfeeding is a natural process, but in the modern day and age, when parents are under pressure, there's a lot of information overload. It's always better to anticipate and support. And antenatal expressing is an important concept, which again you can refer to my earlier video on this topic, so you are familiar with how to support the breastfeeding even before the baby is born. So don't assume that the mother will be able to successfully breastfeed. Watch the transition, support the latch, make sure she understands how to feed the baby and so on. Assuming that everything goes well, the normal lactogenesis stage 2 and 3 takes about 2 to 3 days for the milk to come in after the baby is born. So the first 24 to 48 hours the mother produces only very small quantities of milk. The frequent suckling, we suggest that the mother should feed the baby every 2 hours or so, and there is no limit on how long to feed because the baby needs to get a grip on the latch, and stimulation of the breast, regular emptying of the breast encourages the milk production, because I have explained earlier that there is a factor inhibiting lactation, which if it stays back in the breast and doesn't get removed, it reduces milk production, and removing this successfully improves the milk output. So in the first 2 to 3 days, feed every 2 to 3 hours and as long as the baby needs. However, there is no point in continuously keeping the baby on the breast. If the baby keeps crying all the time, you can use antenatally expressed milk if that is available to calm down the baby. So the mother needs to recover from a strenuous labor process as well. So keeping the baby continuously on the breast makes both the mother and the baby tired. There is no reason to give formula. Make sure the latch is good. Express, hand express, and give a little bit of milk to the baby so the baby calms down, and this also improves the confidence of the mother. Using a pump is not routinely needed unless the mother continues to face problems or the baby has risk factors where we need, like a premature baby or hypoglycemia in the baby and so on. If the mother is going to be working, it's always better to get an electric pump, as it will help her when she goes to work. A manual pump can be used a few times but not for routine pumping, and the efficacy of emptying the breast and the labor consumed is quite significant. So if a mother feels at least part of the feed will be express milk, she should get electric pump. It's very important for the mother to be educated on how to use the pump, how to sterilize it. Remember that you can introduce infection through the pump or through the bottle used for express milk feeding as well, not just formula feeding. So bottle feeding, one of the main hazards is introducing infection, so we need to understand how to sterilize the bottle and how to use it safely. If it is express milk, we need to be clear about how long you can keep. So for example, if you express, you can leave it at room temperature for 4 hours or so if the air temperature is around 24 degrees or so, which is the average indoor temperature. And if you want to refrigerate the milk, you have two options. If you don't intend to use it immediately, you freeze it. Once it is in the freezer, the duration to which you can keep depends on whether the freezer is a standalone freezer for the milk alone, and whether it is a double door refrigerator where the freezer compartment is a separate door compared to the lower compartment, which is the normal, or the upper compartment as your fridge design may be. So if the fridge has a standalone freezer and you're using it mainly for the milk, you can easily keep the milk for 3 months, up to 6 months maximum. However, if it's a routine household refrigerator, better not to exceed 3 months. If it's a standalone freezer alone, deep freezer, you can keep for 6 months to a year, but that's usually in the NICU. Families may not have that option. If you are keeping the milk expressed directly in the refrigerator, in the fridge compartment, which is 4 to 6 degrees centigrade, you need to use it for 24 to 48 hours. Once you remove the milk out, don't put it back in. The milk which is in the freezer, you need to thaw it before use. One way to thaw it is basically to keep it in the fridge compartment for the next day or so. Once it thaws automatically by keeping it the lower temperature, the higher temperature in the fridge, you can take it out, put it in a lukewarm water bowl, or just warm it with the milk warmer and use it. Once you have rewarmed the milk, don't put it back as well. So just take out the quantity you need. Once the milk is thawed and taken out of the freezer, you cannot refreeze it. So these are things, and if you are taking out the express milk, you need to take it in a cooler bag. So the bag can have the milk for 8 hours or so comfortably, again plan according to that. Write the date on the express milk even if you are at home, and use it in sequence. Some people have fascinating ideas that the milk that is expressed at night is richer in serotonin, so you can segregate that if you want. You can use the serotonin rich night express milk for the night feeds, and that may help the baby to sleep better. So coming on to the pattern of feeding, once the milk output has started, the baby can start going longer between the feeds. In fact, it's better to encourage the baby to space, and there is an automatic process. So baby friendly initiative, the encouragement is to feed on demand. But one small clarification here is that the demand is according to the mother's thought process, how she interprets the baby's cues. And in the anxiety prone settings that I explained, there may be an over interpretation of this cue, so the mother may tend to put the baby to the breast more frequently than needed. And remember that if the baby has a larger volume of milk in the stomach in one go, they can go longer between the feeds. But if the baby has a habit of frequently feeding every 1 to 2 hours, the baby is never going to get a full stomach. And also the baby gets used to the snacking pattern of feed. So you need to change, it's a habit basically, and it, like any other habit, you need to try and change the pattern. It's possible to do it. So you can wait 1.5 to 2 hours initially, then as the milk starts coming, the weight gain is there, the urine output is good, you start spacing the feeds better. And once you reach 2 to 5 hours range is a pattern we suggest to continue for a breastfed baby. Most breastfeeding babies feed like 3 to 3.5 hours on their own, so reaching up to 5 hours is possible in some babies but not in all. But try not to feed before 2 hours. If the baby demands within 2 hours, try to wait it out, and remember to give the milk from one breast fully before you go to the next breast. The hind milk is rich in fat, and this will help growth of the baby and satiety as well. So frequent feeding has a disadvantage of sore nipple for the mother. The baby doesn't get satisfied. Because the stomach doesn't empty, there is a higher chance of reflux. The milk keeps entering the stomach which has already milk in it, and so it's like half full or 3/4 full all the time, and this increases the risk of reflux. And there is a possibility of overfeeding. The foremilk is high in lactose and the baby keeps getting the foremilk, so there is a relative lactose intolerance, and this causes griping, colic, and possibly loose stools, which we discussed in a separate video, and higher risk of nappy rash from these aspects as well. And also educate the mother that spacing the feeds reduces the stool pattern. Suppose a baby has a pattern of passing stools with every feed, automatically delaying the feeds. Suppose you reduce 2 or 3 feeds in a day, by the spacing, the stool pattern in a day is going to reduce. So as the baby grows, in a breastfeeding baby, they will space themselves. You can teach the mother to be confident, to space comfortably, and let the baby take the cue. This is about breastfed babies. I'll discuss the mixed feeding and formula feeding next. Thank you.